What's up, everybody? Welcome back to the Move Better channel. I am your host, Dr. Joe, and this is the Professor John Penna-Serrata. Today, we're going to be talking to you guys about tennis elbow and some of the things that you guys may be able to do to help it out. Now, tennis elbow, a lot of the time is a chronic injury. I have a lot of patients that come in here and they've been dealing with the pain for more than a week, more than 2 weeks, sometimes even for months at a time, just because they're not getting to the root problem and fixing the issue. Now, one of the things that I normally check with my patients is shoulder. Shoulder might be an issue when it comes to elbow pain, because if the shoulder's not mobilized correctly or moving functionally, the elbow starts to work for the shoulder, and the elbow is a hinge joint. It's a stable joint, and even though it has a little bit of rotation and movement in there, we want to take away the extra work that it needs to do when the shoulder is out. So today we're going to teach you guys some tricks just to alleviate the pain from tennis elbow, decrease some of that inflammation, and help strengthen along the way. The first exercise that we have is a self-mobilization for the forearm. Now, when I say a mobilization, we're trying to activate the tissues around the elbow and just trying to stimulate all the muscles and tissues and decrease the inflammation that is at the elbow. So first thing you're going to do is go ahead and take a knee, John. And we're going to get this. You're going to place your hand out and you're going to grab that ball. And so all he's going to do is just try to work the tissues above and below the elbow. So you're just going to put pressure, and your goal is to try to relax this arm that's on the table. Put pressure down, and you're just going to roll forward and back. Simple, right? You're not trying to do too much or even too long. You don't need to spend too much time on doing these, on doing any type of foam rolling or self-myofascial release. You're just trying to put pressure into it, trying to stimulate it. Now, as you're relaxing this hand, another thing that he could start to do is start to rotate the elbow around so he can get all the muscles as he's going above and below. Now, tennis elbow is a tendinitis. The reason why it takes so long for it to heal is because the lack of blood flow to the tissues in the area. Now, in fixing any type of tendinitis, we want to try to contract the muscle, not just try to massage it or stretch it out. We want to create some type of mobility with the area. So you're going to go from above and below, so you're going to go above the tissues as well, because these muscles go that attach to the elbow are above and below. And so we don't want to just get the ones that are below the elbow that, you know, work with our hand and our grip strength. Everything kind of works together. So he's going to put pressure there, and he's going to get into his bicep, because this brachioradialis comes from above the elbow, and he's getting into the bicep muscle, and he's just kind of getting all the tissues that are around that area. Remember, 30 seconds to about a minute, you guys. You guys don't have to spend long. We're spending a little bit more time just to kind of give you guys a little bit more direction. The next exercise, if you guys have a set of cups, now I highly recommend getting yourself a set of cups. If this has been a chronic issue, you can simply spend about 15 to 20 bucks, maybe even $25 on a set of cups. Don't recommend anything big. But if you're really trying to fix this issue, one of the things that we utilize in the office is myofascial decompression. That's what we utilize cups for. And it's just a simple suction cup that we can place above and below the muscles, kind of like the self-myofascial release. Now, in this case, we're pulling the muscle and fascia off of each other, creating more of a counter irritant when it comes to the movement of these tissues. Now, you may be dealing with a lot of pain. That counter irritant can actually decrease the pain after we take the cup off. So we're going to start by putting the cup along the brachioradialis, and we're just going to squeeze that. I know it looks kind of funky right there, but as we do that, if you could see, the muscle, the tissue, the skin, they're all just being pulled and sucked up into that. As the cup, the ring on the outside, increases pressure into the tissues. Now, as we're doing this, it's kind of like a trigger point therapy, I guess you can say, but that's pulling more of a decompression rather than a compression. Now, as he puts it there, we're not just going to, let me grab your arm here. We're not just going to let it sit there. We're going to try to get his arm to move in the directions to try to almost floss those tissues underneath the cup as it's going on. So he's going to go down and up, down and up, and then he's gonna rotate his hand around, palm up into the air, and opening it out this way. Palm up into the air, just trying to get as many directions as possible with how the forearm contributes to the arm. So now we're gonna put it above the elbow. Tennis elbow really comes on the outside, on the what we call the lateral side of the arm. So that's the reason why we're trying to place it on top where all the tissues are. So we're gonna do the same thing here, but in this case, now we're gonna try to do the bending the arm, flexing the bicep, rotating it all the way around, bringing it back up, rotating it all the way back around, okay? Now you could do this in various spots of the arm when you're doing some myofascial decompression, but you're really trying to, again, floss that cup through, or floss the tissues through the cup here, and try to alleviate that pain by creating a counter irritant. So more than just massaging the tissues around the elbow, we want to try to activate, we want to try to create some type of isometric tension to the tissues around the elbow. And so today what I want to show you guys as well is grip strength, right? Working with grip strength and kind of creating contraction with that area. Some isometric contraction can actually help alleviate a lot of the pain. And so the first thing we're going to start with are different tools that you can use to work with your grip strength. Now I have this block here that is going to allow John to be able to grip different positions. Now, utilizing different shapes can help create different tensions along the tennis elbow. So here he's using a smaller grip strength, more of a rectangular shape. And he's going to open his arm. Now notice he's not just leaving it down to his side here. He's lifting his arm, he's letting his shoulder do a little bit of the work here, and he's just gripping it, and he's going to start to rotate his hand in different positions here. Now the more we challenge our grip from a small grip standpoint to a large grip standpoint, so as he's here, it's going to be really, it's going to really challenge his grip. Now, sometimes some people might not be able to grip that because it's too wide, but we want to grip small. We want to grip wide as much as we can. Now, this is more of a block shape that he's working with. And then the next, we want to try to have him grip a ball. Now, notice when he grips it, go ahead and just grip it with your fingers here. When you grip it, try not to use your palm. Use your fingers. And you're going to notice that's going to challenge the tissues at the elbow. Now in this case, it kind of sucks that we have to actually go into the pain to decrease the pain, but we want to try to start with isometrics, holding it in place first. And from here, instead of just rotating, we want to work the wrist. So we want to flex the wrist up, and then we want to bring it down. Up, hold it here, hold it here. You want to hold it here for maybe like 15 seconds or so, and then you can release and then bring it right back up again. Okay, and so that one's going to be a little bit different as well. It's more of a cylindrical shape. Same thing with this, with the foam roller. Now this is probably the most challenging because it's going to be, we're actually going to hold it at the top, up at the top here, all the way. This is going to be the most challenging because it's going to have a wide grip. Now this is more of an advanced exercise at this point here because of how much the foam roller is actually going to weigh. So again, he's leaving his shoulder up, bringing his arm to about a 90 degree from his body. And if you can, you're going to end up bringing it in front of you here to do that's it. And he's going to lift that up and he's going to bring that back down. Now that's going to be a way more challenging exercise. This is going to be more like a couple weeks down the road if you have the grip strength. But this is one way to alleviate the pain. And if you don't, if you just recovered from tennis elbow, a lot of the things that I recommend is actually trying to strengthen it. And one of the ways to do it is just by grabbing the foam roller and being able to lift it, rotate it if you can, working any type of grip to help strengthen those muscles around the elbow. Now the last one I want to do is some extension exercises. Now we're talking about grip strength here. We want to work on the muscles that actually work on bringing and opening our fingers out. And so one of the things that we used to do in school in order to create better grip strength was we used to use rubber bands around our fingers. So let's go ahead and place that around, and we're just going to show the camera here. You're going to put it around all your fingers here. Now, one of the things that people do is they just open up their fingers. That's not what I want you to do. You got to keep the rubber band around your nails, and you're just going to hold it out, almost like you're about to grip or grab something. you're just gonna spread your fingers apart, make sure that middle finger is nice and tall, and you're just going to bring that hand up and back down. Bring it up, hold it up there. You're gonna rotate it around like you're squeezing a knob, bring it down, and then right back up. You're gonna feel all that tension. I mean, I feel the burn right around through my elbow in this area, but this helps with grip strength just because you're counterbalancing the tissues that you normally do on a daily basis, which is gripping. We wanna just do the extension patterns. We wanna open up our hands. So the last exercise that we have today is utilizing a stick. Now you guys may have some PVC pipe around, you guys may have stick mobility, you guys may have a broomstick laying around. Make sure that you guys utilize that because that can actually help a lot with your tennis elbow or pain around the elbow. So the first thing I'm gonna have John do is he's gonna go ahead and grip it and he's gonna hold it right in the middle first. We're gonna test to see how much strength he has. Now that feels pretty easy right here, right? Now if we wanna make it harder, we just move down the stick. Is that a little bit better there? Now, it depends on where you are at with the amount of pain that you'll be dealing with, right? For some people, I have them at a little bit more of an advanced stage where they're holding the stick all the way at the end. Now the goal here is to try to keep that level. Imagine you have a ball or a water or a can of water that's like hanging from the other side and you're trying to make sure that that doesn't spill. You want to make sure that you're stabilizing just by holding that grip nice and strong. Now the first, if you guys can zoom in on that, he's shaking already because of how tense this small stick can actually be. So we're gonna make it a little bit easier for him. We're gonna bring it right down there. That's way easier right there, right? And all he's gonna do is first hold for about 30 seconds. When he's a little bit more advanced or it's a little bit easier, now he could start to work on rotation up and then back down. And he's trying to slowly move that forearm, not too fast. You wanna make sure you take your time with it because you want every single part of that tissue to increase some stability for that elbow. Again, his hand is up nice and tall. His hand, his shoulder, and his body is gonna be at about a 90-degree angle, and he's just rotating it. Now, the next one, I call it knighting. You're gonna hold it still right in the middle, hold it, or right back where you were at. The next one is gonna be a knighting, almost like he's trying to knight somebody. He's gonna bring it forward. He's gonna tension all those tissues, and then he's gonna pull it on back, contract the tissues now, and then he's gonna bring it back forward. Now, the wrist is a very mobile joint as well. We wanna make sure that we're working in different planes as we're working with this stick. Now we're gonna go from here. Now as you point it, you can also rotate it back and up, back up. So just kind of playing with all different planes, rotating it back, thumb back towards your body, try to tap your shoulder here with the stick, and then he's gonna bring it right back forward again, and then back to rotation. So it depends on where you are at with your treatment or with your care. You can make it easier, you can make it harder. Because if we bring it down into this position where he's holding it even further and the stick is nice and long, it's gonna be a lot harder for him because of how much gravity is taking over on that stick. All right, so I hope that helped you guys with some of your pain that you guys might be dealing with in your elbow. Make sure that you like, subscribe, comment, tell us a little bit more about how you guys are doing with some of the exercises that we just gave you guys today. We wanna make sure that we hear and help you guys out, all right? Thanks again for joining us on another episode. We'll see you guys later. Thanks, guys.